Now here's one. All of you know that every vaccine licensed on the market today says for administration to healthy animals. Well, what do you do about a 6-year-old cushingoid patient? Any dog with a long-standing systemic or chronic illness is a challenge when it comes to vaccination. Could you just vaccinate the dog? Yes, you could. And in some cases, states require rabies, regardless of the health status of the dog. But for distemper, parvo, and adenovirus, you at least have the option of testing to determine whether or not they even need a vaccine. If they are positive, I would certainly advise delaying administration of a vaccine. If they are negative, then it's your call. You've got to come to grips with the purported risk of that individual patient, risk for exposure, versus the risk of giving a vaccine, which in the case of a serious chronic illness like Cushing's disease, the patient might not respond to the vaccine. I don't think the vaccine is posing a risk. It's just failure of that vaccine to induce a protective immune response or a boosting effect when the patient has a serious systemic or chronic illness. Dogs with a history of immune-mediated hemolytic anemia or thrombocytopenia. The interesting issue is, do vaccines cause immune-mediated disease? We don't really have hard science behind that question. But a lot of the immunology experts that I get to sit at the table with suggest that vaccines may not actually cause immune-mediated disease, but vaccination could, in fact, reactivate it in a patient with a history of immune-mediated hemolytic anemia or thrombocytopenia. So the point is, in the AHA canine vaccination guidelines, we have recommended against arbitrarily administering vaccine to any patient with a history of an immune-mediated disease. So this now, the opportunity gives to actually test the patient, gives you objective information as to whether or not the patient even needs to be vaccinated. With regard to in-clinic point-of-care testing in the United States, there are 2 kits available. Outside of the United States, only the VaxiCheck is currently available, as I understand it. The VaxiCheck test kit is the most recent technology for testing antibody, and there are test kits for distemper parvoadenovirus. That's one test kit. A separate test kit will also provide antibody to feline panleukopenia. For veterinarians in the United States, Zoetis also sells a test kit that they had purchased from a company several years ago called Titer Check. These results are only for canine distemper and parvovirus versus the 3 antigens provided on a test for VaxiCheck. Now, I wanted to mention to you that the test on the right, the Titer Check test by Zoetis, and the VaxiCheck test shown on your left have both been validated or correlated with the reference standard titer tests. And there is, and I repeat this, there is exceptional correlation between those. A positive is a positive, whether it's a titer or a color change on a card. So be aware of that. I would also mention to you that the test kit on the right, the Titer Check test kit by Zoetis, is more suited for batch testing. It is more labor intensive, although it requires both tests can be conducted within 25 minutes. The advantage of the VaxiCheck is you can either do multiple patients at once or an individual patient.